Talanoa is a word that is derived from the Samoan culture, which means having a conversation. This word can also be broken into two. Tala means story, and Noa means to tie, which brings us to Talanoa. Utopia Washington has created Talanoa as a platform to provide safe spaces for our queer and trans-Pacific Islanders to have a conversation, share their stories, and for community members to make a connection. While Talanoa is usually hosted in person, due to the pandemic, Utopia Washington has been able to utilize digital platforms to bring you Talanoa virtually. We are glad to have you here with us today. Welcome to our Talanoa.
Talaflava, and welcome to our Talanoa, MedicAID-ing TransHealth in Washington State. But before we move forward, I would love to acknowledge the land that we occupy. Here in Utopia, Washington, we continue to recognize that we, diasporic indigenous people, recite and pull resources from the ancestral lands of the Coast Salish people, the Duwamish, Muckleshoot, and Puyallup nations. It is important to understand the long-standing history that has brought us and other settlers, colonizers, and indigenous people to reside on these lands and to seek an analysis and continue understanding of our place within that history and present being. Indigenous First Nation people are still here, and we aim to help them in their rights to thrive and self-govern. If you want to know whose land which you occupy, you can do so by visiting the link in the chat, which is native-land.ca. First off and foremost, I would like to introduce myself. My name is Kimmy Faui, and I work for Utopia as a SWEI program coordinator, stands for Sex Worker Empowerment Initiative. My pronouns are she and her, and the location and the land that I occupy, and that pertains to the Duwamish people and the Duwamish land, the Coast Salish people, and the Muckleshoot tribes as well. And I would like to give this opportunity to my co-host.
Hi, everyone. My name is Adriana Suluai. I use she, her pronouns. I also occupy the lands of the First Seattle people, specifically the Duwamish tribe. Here at Utopia, Washington, I serve as a program manager, specifically for our Sex Workers Empowerment Initiative program. Tonight's Talanoa, I'm very excited about this conversation as Washington continues to stay ahead of a lot of its policies around gender-affirming care and even for trans health. Tonight, we will get to hear from folks on some of the new changes to the policies with gender-affirming care and even trans health here in Washington through MedicAID. So sit back, relax, and if you have any questions, please do so. Drop it in the comments section below. Our commentator, the lovely Miss Tweety Fatuisi, will be sure to pass it along to us so we can ask our panelists at the end of the show. So how are you feeling, Kimmy?
I'm feeling great. As you can see, this beauty sits.
There you have it, people. This beauty sits. We have a very wonderful panel tonight with us. A lot of folks who have been spearheading this work and being ensuring on getting a lot of this very important information out to community about some of the things that I even myself haven't heard before. But tonight you'll get to hear it as we dive into details about some of the changes and even you as yourself, what is covered through MedicAID when you are seeking gender-affirming care, even for trans people and gender non-conforming people. So I'm going to go ahead and start. Or would you like to start, Kimmy?
Yes, I would love to introduce Catherine West. Is a staff attorney with Legal Voice. She fights for gender equity with administrative, legislative, and litigation strategy in partnership with community organizations, and individuals. She assisted with passing the Gender Affirming Treatment Act at the Washington legislature and advocated for improvement in Medicaid rules for gender affirming healthcare. Catherine has spent 24 years working to better the lives of marginalized people. She is a member of the Washington State Bar Association and a Quinault Indian Nation Tribal Bar. Welcome, Catherine. Wes.
Thank you. It's a pleasure to be with you.
You too as well.
Thank you for being here, Catherine. I'm going to move on forward to introducing our next panelist, the lovely Helen Weiss. So Helen is non-binary, queer, Jewish, lifelong learner who is honored to serve trans, non-binary, and gender diverse folk in primary care as a gender health navigator over at Carolyn Downs Country Doctor Community Clinic. A speculative fiction enthusiast, they can often be found biking, hiking, or partner dancing with their wife, child, and dog. Hi, Helen.
Hi, Adriana.
Thank you for being here today with us.
Thank you for having me. It's great to be here.
Oh, thank you. Moving along to our next panelist, Gabriel Newman is a 2022 graduate of Seattle University School of Law. He currently works for GSBA, Washington State LGBTQ plus Chamber of Commerce, where he will soon begin a new role as a policy advisor and legal advocate. Gabriel has worked with Q Law Foundation and LCYC on advocacy projects to advance support for the LGBTQ plus community. Over the past year, he has worked closely with Q Law Foundation to develop the policy and resources guide for trans and gender nonconforming people as they navigate our state's healthcare laws. Welcome, Gabriel. Gabriel? How are you, Gabe?
Great. I'm really excited to be here. Thank you so much.
Thank you for being here.
Our last panelist, Dusty LeMay, is an attorney at the Northwest Justice Project, where he works on public legal education content for the WashingtonLawHelp.org website with a special focus on language access and multilingual material. He also runs a pro bono project focused on trans rights in rural areas that help with identity document related issues around the Washington state. Welcome, Dusty.
Hi, everyone. Thanks for
Hi,
having us.
everyone. I'm glad that we're all sitting on the same screen, sharing space on this wonderful evening. I know it's a little bit hot outside, so I hope you're staying cool before we dive deep into these great conversations. So I'm going to roll us into a little bit of an icebreaker. I'm going to go ahead and model. It goes as a young LGBTQ person, I've always felt blank. That's why this Pride season I am sponsored by blank to blank. This was a very fun idea way that we can start off our conversation this afternoon. And I can go ahead and model. So as an LGBTQ person, I've always felt we needed a better environmentally friendly detergent. That's why this Pride season, I am partnering with Tide to reveal it's gotta be clean, it's gotta be Tide environment friendly detergent. Give it a shot, Kimmy. I want to see what you got.
As a young LGBTQ person, I always felt sexy. That's why this Pride season I am sponsored by MAC to lift up folks that insecure about their skin and by trying to be that true self of themselves, try to be true to themselves. So MAC is my go-to for this Pride season to be probably sponsored.
Oh, so you're sponsored by MAC. How lovely. Is that a MAC lipstick that you're wearing?
Yes, it's color Stay. Isn't it beautiful? And we can do it popcorn style.
Who do you want to shout it to?
Okay, I'll go with Catherine.
I'm ready. That was a good pick. As a young LGBTQ person, I always felt I wasn't very good at sports. And that's why this Pride season, I'm sponsored by the Seattle Storm so that I can get special training from Sue Bird.
Perfect.
Oh, popcorn. Dusty.
I've been thinking about this one all day. So even though I was like raised in the country, going to country prides, one of my biggest complaints about all prides, and as a young LGBTQ person, I thought that Pride needed more fried food like the fair has. And so this year I'm partnering with Crisco to put the fried back in Pride. And I'll pass to Helen.
Thanks. I hate to follow that, Dusty. That's so good. Crunchy. As a young LGBTQ person, I always felt like I had X-ray vision. That's why this Pride season, I am sponsored by Diagnostic Imaging. All the hidden beauty. Adriana is showing us the beauty, but some of us have some hidden beauty. I'm going to pass it to Gabriel.
As a young LGBTQ person, I've always felt like I was searching for a really good binder. That's why this Pride season, I'm sponsored by Caterpillar Construction Company to finally manscape.
That was a good one.
Popcorn. I think that's everyone went. Yeah.
Thank you, guys. Again, it's really lovely to share space with you guys, especially on this virtual platform, our Talanoa. But let's dive straight into it. I think a lot of people are eager and ready to learn about what are these new changes. Like, speaking as a trans woman, I know that it's pretty amazing. It's pretty amazing how far trans care has come in Washington. No longer do I have to rely on black market just to receive drug. I know. Yeah, and no longer do folks have to rely on black markets here, where that they can seek gender affirming care and TransHealth through medical providers, and this is all provided through MedicAID. So let's start off today, our Talanoa, with the question. It's, what is gender affirming care? I think a lot of people are always wondering what gender affirming care is, and why is access to gender affirming care a priority in achieving health equity for a trans, non-binary, and intersex community? I'm going to shoot this one out to Gabriel.
Thank you. This is a really great question because transition looks different for every person. And there are many ways to be trans or gender diverse. So the goal of gender affirming care is essentially to help your outward traits match your gender identity in whatever way that works best for you. So gender affirming care is any healthcare that you need or that you receive that helps your body and your gender align. So that can be hormone treatment, voice therapy, surgical procedures, or changes to your face, genitals, or other body parts. So there are many different kind of ways to for gender affirming care to look. It can also be just one treatment or procedure, or it can be many. Sometimes folks, are really only searching for that one thing, and then other people want a lot. And there's many different ways to represent yourself. And so because of the many different kind of ways to be a person, to be trans, to be gender non-conforming, it's really important that our healthcare system provide for folks to be able to, pick the path that they want and to be able to go on, a multitude of different things that might be different from what other people might be going on. So, so that's partly why it's so important to really focus that and have the onus, the focus being on gender affirming care as it is a holistic treatment. And then also, we've had a lot of historical marginalization this community is faced with regards to healthcare as well. A lot of trans healthcare, and because we've kind of been siloed, there's been a lot of this historical siloing of identities into specific genders or specific buckets. It's been really hard to for folks to actually be able to customize and to present themselves, especially like with those gender nonconforming identities as well. But yeah, if any of my fellow panelists want to elaborate on that, because it is truly unique to everyone.
Yeah, I mean, I think even the new law kind of recognized that, right? Where it was recognizing that gender affirming treatment is not just limited to those things to treat gender dysphoria as prescribed by your doctor, but anything related to gender identity and related medical conditions. I know a lot of us don't even have gender dysphoria diagnoses and don't want them, or aren't navigating that. And so the breadth of the way it was written hopefully is going to include folks with the diversity of ways that they're identifying showing up at the doctors. One of the crucial things that I kind of want to reiterate a bunch is that for coverage under the law, it does have to be prescribed by your doctor, right? Since we're talking about insurance stuff today, there's lots of ways we all affirm our genders in tons of ways all the time, but it is really crucial under the law that it's coming from your doctor or medical provider, or whatever kind of provider your insurance has to come from, right? But yeah, the law itself is intentionally broad. I'm assuming, in order to kind of address what Gabriel was saying about how broad our community is and the needs that we have.
That's right, Dusty. And Washington's approach to healthcare is based on the informed consent model. And the informed consent understands that patients can determine what is best for themselves and for their health. And so, so in the law, folks can use informed consent basically to work with their doctor, demonstrate that, you have an understanding of your risks and benefits, why you want to go on certain types of therapies. And the doctor understands that if you can provide that, they'll work with you. And that's a really awesome model for our state to have.
Yeah, and I think what Kimmy, what you were saying about taking it off the black market, I mean, this is one of those things where we've only been able to go to, I'm a trans person and, have been dealing with medical transition for decades. And we've only been able to go through insurance and having things covered and being in these medical environments for very certain things. And even that we had to fight tooth and nail for. And we had to kind of piecemeal all of different treatments or things we might need in different realms and different areas. And so this is kind of nice in the sense that, you can try to meet a lot of your gender affirming needs under your insurance carrier now. And it should have equitable coverage, ideally, right? In the way that, we'll see how this all plays out. But that just really spoke to me when you said that during the introduction, Kimmy.
Thank you. And thank you for talking about it. I think these are talking about gender affirming care also brings up in my mind. I'm wondering, when community are seeking gender affirming care, is it person specific or person centered, or is this based on a recommendation of a healthcare provider? When I myself go into to seek assistance with getting gender affirming care, I see, Helen, that you're nodding your head.
Yeah, I'd like to talk about that. I also just want to put a disclaimer. I'm not a medical provider. A lot of love to the medical doctors, nurse practitioners, and physician assistants who work in community health, who I have the privilege of working with at Carolyn Downs Country Doctor Community Health. Yeah, I appreciate what Dusty was saying about the involvement that we have with the medical system, but as people with who've been marginalized, we are sort of dependent on the medical system for some of our treatments. If we choose to have hormones or surgery or other procedures, but the medical community hasn't always been inclusive and welcoming and knowledgeable about our needs as trans and gender diverse people. for example, you don't really need authorization from anybody to treat your diabetes. Like if you have diabetes, you need it's the hormone that you need, which is insulin. And people are going to monitor you and care for you. Because of gender identity being marginalized, I need someone with a degree to support my health care. I need someone to prescribe hormones if that's part of my journey. I need someone who's a licensed clinician within Washington State to support if surgery is part of my journey. So it's an interesting tension. I really appreciate what, Gabriel, you were saying about the Washington State healthcare model being based on informed consent. And I think that that's something that people in healthcare talk about a lot more with regards to other types of care and the shared decision making that we hope to manifest when we work with community members. So that. Thank you.
Thank you, Melanie. Thank you. I hear you talk about procedures and hormone replacement therapy. So I think a lot of folks are now probably thinking about is facial feminization a part of this? Is getting breast augmentation a part of these procedures with Medicaid? I know a lot of folks always stay worried with hormone replacement because the cost of hormones themselves, a vial was an arm and a leg. Are those kind of some of the covered things with the new changes to the policy and updates to the TransHealth policy through Medicaid?
Go ahead.
No, go ahead, Ellen.
Yeah, hormones are covered by, if you have Medicaid, they would be covered. And it's hard for us to carry testosterone because it's considered a Schedule 1, it's considered a controlled substance. So it's a little bit more complicated. Sorry about that. I'm making a lot of noise here. I got a drum set. Can I just yeah, but we do carry estrogen at our in-clinic pharmacies. We're fortunate enough to have a really great pharmacist at Carolyn Downs Country Doctor, and we can carry a lot of medications, pretty common over-the-counter medications. Right now, we're not able to carry the testosterone, but we are able to support with prior authorization from insurance companies that might require. It's basically just like a statement from your insurance company that they're going to pay for the medication before you start the medication. But I mean, going back to the question that you asked earlier, Adriana, about is the medical care, is there a prescribed way that we want to see people pursue their medical care versus is it patient-centered? Is it tailored to the individual? And shared decision-making means that your primary care provider is an expert on pharmacology, but you are an expert on your own body. Mm-hmm. And you want to be in the hormonal environment that's comfortable to you. So that's what we're trying to do. We're trying to bring those two expertises together and, come up with something that works great for the community member that's working with us.
Awesome. Thank you.
Catherine, did you want to, it looked like maybe you were going to pipe in about new services that are covered, and that would be great.
Good prompting, Adriana and Dusty. I just wanted to name that one of the big things that have changed is the coverage rules for gender affirming care under Medicaid or Apple Health. So the rules changed almost a year ago exactly, and they got a lot better. So many people had heard that certain procedures were not covered. They were never covered, like facial feminization surgery. And that was because there was a list of procedures or services that were just spelled out where the healthcare authority said, we're just not going to cover those. And, I supported clients who had very significant barriers as a result of not having access to those specific surgeries or procedures. And we really tried to mount a case to say that, obviously this community member needs to have this service covered by Medicaid, and you couldn't get anywhere with that. And it was just a very frustrating process. But the good news is that now that long list of services is gone. And so the healthcare authority is now evaluating every request for care, for gender affirming healthcare, for medical necessity. So based on, what's appropriate for you, as Helen named, that with a prescription from your doctor. So that's a huge change. And I think that there's lots of people in the community that aren't aware of that change. And the thing is, you may have applied, a year ago, 2 years ago, been denied and think like, well, that's it. I'm never going to be able to get that care. And so we're here to make sure people know that actually those rules have changed. And if you applied before and you got denied, you should try again. There were some other good changes under the rules as well. For some services, you need a psychosocial letter, and that needs to now be valid. It's valid for 18 months, which is important because it's hard to get to schedule all your appointments and get in with providers. So having a little bit longer time on those letters, we're hoping is helpful for community members. Another example of a change is that now folks who have intersex traits, who may have had surgeries as a child or as an infant that they didn't consent to, or who may need, additional surgeries, those are now explicitly covered in the rules. Whereas before, the healthcare authority it wasn't clear how they were going to treat those. And so we were seeing that people were not getting the care that they needed. There were some other changes, including around after you had surgery, they used to require that you had a plan, or you were able to show that you would be able to recuperate or have post-operative care, which was really difficult for unhoused community members. So a lot of those barriers have gone away. The final thing that I'll say is that there used to be a requirement that someone be on hormone therapy for 12 months prior to moving forward with a gender affirming healthcare request. And we know, as everyone has named, that gender affirming healthcare is it's not a schedule, it's not a checklist. So there's no reason why folks should be required to go through hormone therapy. This is very individualized and needs to honor the individual's, experience in their body and in communication with their doctor. So that requirement has now been modified to say that hormones are necessary only appropriate to express your gender. So those are really great new changes under the law, but they are very new. And so we, really encourage people to apply again if they were denied before. And also want to hear from people about their experience as they're going through that, because we know that these rules are new and the healthcare authority may not be getting it right every time. And so just really, want to get the word out to people and to make sure that they know that there's support if they need help.
And
Thank you, Catherine.
Oh, go ahead, Kimmy.
I'm sorry, go ahead, Dusty.
I was just going to say, just kind of a nuanced part of that too, is that under the new gender affirming law, a lot of the services that were previously basically banned as cosmetic, or if there were just blanket exclusion policies, those two things aren't allowed anymore. So insurance companies in Washington can't deny coverage for a trans or gender diverse procedure because it's cosmetic. And your insurance policy can't have an outright exclusion on all gender affirming treatment anymore. And those apply to Medicaid. So it's a different law that's broader than Medicaid, but it does apply to all the different Medicaid plans in our state. And then one of the things, facial feminization surgeries and other raising facial procedures are one of the biggest questions that I've heard a lot, like from my community and friends and just in general. And I think that one of the biggest points of information that I've been hearing everybody wanting to share is that all of these services are going to ideally be covered now to some capacity. Every plan is going to be different, right? Every insurer is different. But one of the things that has been consistent is that there is part of the law says it has to be, the typical medical way to treat something. So there are a lot of different ways to have facial feminization surgery and a lot of different types of feminizing surgeries for the face. Rhinoplasties or nose jobs has been one of the big questions that's come up. The way that I understand what the insurance commissioner has said in Washington is that those should be covered if it's otherwise eligible as prescribed by a doctor for your gender identity or related and is considered a reasonable treatment. I do know personally of some people that have had experiences where when they've asked for a lesser traditional kind of facial feminization surgery, that then even if the insurance is covering it, a lot of times they might have to go out of state, and that will create a bigger process that will have more paperwork and things than not. But I haven't heard of anyone be denied yet. I've just heard of folks, requesting what would be considered a lesser traditional one. It's still ruled as medically necessary. It's still considered a reasonable and common enough treatment. The problem is there's just not providers around here. You might have to prove that the providers aren't good enough and that you want the exception to be able to get another provider. But so far I've seen trans women in my life have success with that just in the last few months. It can get really confusing. So definitely really lean hard on your insurance navigators if you have them through your health plan, or if there's a trans team at your insurance companies, like a lot of the bigger insurance companies have now, because when you start to get into the more specialty type procedures, you might need single case agreements and things that are going to be tricky. But so far, I haven't heard from any of my community that there's been denials. In fact, I've been hearing everybody getting approved for their FFS, even the non-traditional requests. And I definitely would encourage folks, if they're wanting rhinoplasties and things like that, like Catherine said, put in, even if you got denied before, just go ahead and put it in and see if, what has changed now. And then the resource I'll go over here in a little bit. I'll share some resources about how you can appeal any decisions in case you are denied too, and what to do if you do get denied.
Can I failed to name the year-long community effort that went into getting the healthcare authority to change those rules or to make them better. So I just want to honor all of the trans and gender diverse people who were involved in talking to the healthcare authority and advocating for that rule change, who were sharing their stories, who went down to Olympia to testify. It was a multi-year effort, and it was, there were a lot of false starts, and it took a lot of heart and a lot of hope and commitment for people to keep going and engaging in that process. And so it's so wonderful to be here to say that finally happened, but there were so many years where folks were working on it. We were encouraging people to keep telling their story, but it was also, heartbreaking to watch folks go down and share their story. And then for years, nothing would happen. And then we would pick the process up and do it again with, renewed hope. And I suppose that's always the way that it is, that, we work on efforts and we hope for the best and we know that there's a better future. So this is one of those times where that community effort has been realized. And I just really want to honor and name all of the individuals and all of the heart and soul that went into getting these rules to change, because things don't change. The healthcare authority didn't finally decide to change these rules on their own. It was the community coming forward and really advocating for this. So thank you for letting me name that.
Thank you, Catherine, for shedding light at that. I think it's very important that we also take time to sit back and give grace and gratitude to all the folks who helped push a lot of this work further. So not only the current generation, but also future generations. Crossing my fingers that they don't touch it, that they keep making it better, but not make it worse. Continue to thrive with all their authenticity. And the state continues to recognize the autonomy of trans and gender diverse folks when they go into spaces to seek assistance and to seek help or support with their journey with gender affirming care. Dusty, I know you talked about a guide.
Yeah.
Do you want to talk a little bit more about that guide?
Yeah, I'm gonna share my screen. There'll probably be a moment of a delay. And I think that this is going to be available to you all through a link in the chat or otherwise as well, hopefully. So can somebody tell me if they see my screen?
It's loading.
Yeah?
Loading.
Oh, still loading. Okay. It's telling me, Sharon. Let's see. Got it. Okay, we got it. Great. Okay, so you all can see the publication now, Catherine? Yeah? Okay, great. I can't see your faces anymore since I'm on the screen, so I was like hanging out there. I work for Northwest Justice Project, and we're a big statewide legal aid in Washington, serving low-income folks in every county for civil legal issues. But the team I work on is WashingtonLawHelp.org, which is the easiest way to describe it is like a free online legal library for people who aren't lawyers and need help navigating legal stuff by themselves. So there's all kinds of stuff on the website, like how to do your own divorce, how to deal with get your own protection order, how to do a name change, how to deal with all kinds of public benefits issues and immigration issues. But we also have a small and growing LGBTQ and civil rights part of our website and library. So I've been working on this publication that's kind of a 101 intro to the statewide law that we were just talking about called the Gender Affirming Treatment Act. And this is really meant to be like a Q&A for communities. So there's a little bit of intro stuff about what it is, and it helps remind you that, the things we've been talking about, it has to be medically necessary, prescribed by your doctor, a kind of recognized and regular treatment in the medical community. But then it gets into all these kind of Q&A things. So, does it apply to youth? Yes, it does. And then what specific treatments are covered under the law? This is a part of the publication that I've already used a ton when friends have asked me, and that I imagine, like you asked Kimmy, like this is what everybody wants to know, right? Is that this is straight from the law and from the insurance commissioner's website of what is supposed to be covered now. So it's comprehensive, right? And the biggest exceptions to these are kind of what I said earlier, that if you're asking for non-traditional versions of these treatments, that they could be denied, or that they could ask you to have some kind of alternative process for requesting that, right? But in general, this whole list of services, which includes not just FFS, but specifically the insurance commissioner listed other gender affirming facial procedures, which me as a lawyer, my lawyer brain says that's a nose job or rhinoplasties, right? And this is a good time to say that for myself and other lawyers on the call, we're not giving you legal advice today, right? This is just general information. We're not your attorneys, but we're just here helping out and sharing information in community. And if you do need legal help, at the end of this document, there's lots of ways you can scroll down and find ways to get in touch with both Q Law as well as Northwest Justice Project, where I work. And then hopefully Catherine can give you all info about how to get connected to Legal Voice if you need to as well. So one of the points, so this publication is going to be available on our website next week when our coordinators finish putting it up. But in the meantime, I wanted you all to have a community version of it. So you should be able to access it and keep it for yourself and read it. And also let me know if you see anything that needs to be changed in it, or if you have other questions you want added to it that aren't being answered in the Q&A. One other thing I wanted to really drop that's important to y'all's community, to Utopia, and to my role specifically, is that I get to focus on the multilingual content on our site and working on reaching in to limited English proficient communities, but just multilingual communities in general. And so we're definitely going to get it translated into Spanish and some of our other core languages. Helen put some really good suggestions for me about some African languages to get it translated into. But a part of our regular work is that we have small libraries of translated content in Samoan, in Marshallese. We have a few Chuukese documents. And so if there are any languages specific to your community at Utopia that would be helpful, where you're like, yeah, a lot of us speak English, but a lot of us would prefer to have this in our native language, and this is what it is, please let me know, because it's something that I can do in my job, get it translated. Regularly, we're translating into Marshallese and Samoan no matter what. So that's a regular relationship we have with translators. And then Chukis as well. Down where I live in Vancouver, we have a big Chukis population. So I can work on getting this resource, more culturally appropriate into languages for your community if you all need. And then I just kind of wanted to run through some of the questions, because I know this is probably on everybody's minds, because it's been on our minds, and this is where it came up, is that you can be denied, right? There are ways to be denied under the new law. The main thing is that if you ask for a gender affirming treatment and your health insurer denies it, they have to deny it after they have a healthcare provider who is actually experienced with gender affirming care review your request, and then that healthcare provider has to say, this isn't medically necessary to treat gender identity or dysphoria, or it's medically necessary, but you're asking for a procedure that is so non-traditional that it's basically not in the recognized scope of normal procedures like the law says it has to be. So that's where I want to give people that heads up, where if you're asking for some non-binary types of chest surgery, sometimes that could come up, but specifically it's going to be around FFS or kind of new or different non-traditional versions of other therapies that might otherwise be pre-established. And then just reiterating, no more blanket exclusions, right? And that this applies to all insurance carriers operating in Washington. And the main thing I wanted to show you all is that if you get denied, you have options to make appeals. And so you should be able to click on the links in the document to take you to where you can learn about making appeals for denials through the insurance commissioner. And also, if you feel like you got denied because of your gender and it was unfair, or that this law wasn't applied to you in the way it was supposed to be, you can make a complaint. And the Office of the Insurance Commissioner in Washington has committed to investigating the complaints, as well as issuing a report at the end of this year about the kind of geographical equity of this law. So they're supposed to, by the end of the year, help provide insured consumers in Washington, all of us people, with information about how to better access where all the providers are in their area and how to access all the different covered providers. So particularly this last page is really helpful for giving you the links to filing a complaint with the insurance commissioner, or how to navigate appealing the denial, which I think is always worth it if you have the option. Always try to appeal if you can. Oftentimes in the appeals process, you can learn about the reasons that you were denied, and sometimes it can be something that was just bureaucratic, or a letter wasn't phrased right. I've already seen that come up in the last few months since this law went into effect, either in community with friends seeking different treatment, or my friends who are providers and writing letters, that there is starting to be a little bit more strict language around letters, and that would make sense, with the new law. And so you might get a little more letter kickback than you used to. And so we're just going to have to work on coaching providers into having some sort of exact language. One of my best friends is a therapist and was just asking me this 2 days ago, because the letter she's been using forever got kicked back. And I was like, oh, I can see exactly what it was about. And it had to do with the kind of changes in the law and the way things need to be phrased. But you should generally gender affirming care is supposed to be covered now. You can also contact a lawyer. There's lots of different ways to do that, including information for getting a hold of Northwest Justice Project at the end of this document. Washington State Bar Association has lots of ways for finding lawyers in their legal directory and otherwise. And then I also wanted to make a plug here for the Q Law Foundation. The Q Law Foundation, who's been a collaborator on this effort and many others, are a big resource for the LGBTQ community in Washington. They have a resource and education page that's linked here. You can also possibly get help with their legal clinic. And Gabriel, who's on the call, has been working on a much more in-depth resource than this one that will hopefully be linked here soon as well, so that, for getting a kind of intro to it, you can look at this. And then if you really want to kind of go deep and need help navigating the processes, there's Gabriel's as well. So that's the guide I was talking about, and that you all hopefully have access to now. And let me show you really quick while I'm still sharing screen. So a week from now, once our coordinators have finished doing all of the magic that they do to get my simple Word documents onto an online platform, you can just go to WashingtonLawHelp.org. And if you just type in gender when you're on our website, it'll take you to what is essentially our section on gender. And so you'll see a lot of, gender marker change, name change stuff, all the different kinds of update things. But as of next week, one of the first things that comes up should be the publication you're looking at, the Gender Affirming Treatment Act one. And then also, just kind of while I have everybody on the screen real quick, if you ever need to find our language resources, which is hopefully where the translated version of this will live in a few months, you can just go to WashingtonLawHelp.org/languages. And then you can scroll around and see all the different things we have in different languages. But I'm hoping to get it out in quite a few. And so if there's anybody on this call that wants it in Samoan or Marshallese or Chuukese or anything, please let me know and I can get it done and then add it to this language page over here. And specifically, one of the nice things is that our language pages can take you to the different sections that everything is in, but it also will give you our referral information and the actual language itself too. So I wanted to just share that real quick while I had everybody's attention on screen and to kind of give you a plug for next week where you can look for this document in a permanent place that it will live on into eternity. So I'm going to stop sharing my screen now, pass it back over to you all.
Thank you, Dusty. I think my brain just went kaboom with all that wonderful resource that you were able to share with us, and especially going through that guide. So there you hear it, everybody. Never be comfortable with a deny or with them saying no. Go back,
Yes.
knock on that door.
Yes.
If you need help, grab one of your friendly neighborhood organizers or organization that can help you support with getting your letter approved or getting you better access to your gender affirming care.
Yes.
Yeah, I mean, gratitude to everyone in here. I know folks out there are eager to learn these resources, like a lot of information that they need to know now, that they know now, that they can go back and then redo their claim and to get the right affirming care for themselves that they have been denied in the past. So, we want to mindful of people's time. So we want to move to question 3, and that would be with the new changes, we are still sorting through how HCA is handling them. Can you share knowns and unknowns regarding coverage and the new Medicaid rules? And I would direct this question to Helen.
Thank you, Kimmy. That was amazing, Dusty. I really appreciated all those resources. So, like was discussed before, facial gender confirmation surgery used to be disputed as cosmetic, and it was denied. People are starting to be able to meet with surgeons and plan for these procedures. Like Dusty outlined, there's some traditional and then less traditional procedures. There's probably over 20 different procedures that someone might want to talk with a surgeon about and can be accommodated. Sometimes procedures are staged. If it's going to be like too hard on your body to get everything all at once, they'll do it over, they'll give you 3 months to recover and then kind of come back for something else. And also body contouring, fat transfer, or what's colloquially referred to as a BBL or a Brazilian butt lift, can give a more feminine appearance to the body, and that's being covered, and it's also being offered in Washington, in Seattle, which it was not previously, so that's pretty fun. I was actually really excited to see that breast reduction was on there, and that's something that some people will be very affirming for some people in their experience. So that, again, going back to, is there a hormone requirement before you can move towards surgery? Traditionally, there used to be a requirement that you have hormones for 12 months. That is not even taking hormones is not a prerequisite for any surgery. I think it's a conversation with the surgeon regarding breast augmentation, because after 12 to 24 months of estradiol, a person will start to see some breast augmentation from hormones alone. But for some people, their gender presentation requires more, that would require implants, and not enough that would be created just by hormones. I'm sort of rejoicing with all of you, but I'm also like feeling aware of the gaps that are there. I don't want to bring the mood down, but I kind of want to just hold space for the fact that even though facial hair removal is a covered procedure, it is available in only 4 cities in Washington, in Spokane. Can conveniently in Chehalis and Olympia and in Seattle. And as you can imagine, the office in Seattle has a long waiting list. And so I just feel like the need for more trained medical estheticians who can offer this service. If there's somebody on this call who's thinking about ways to elevate the community, we would love some scholarships for trans and gender diverse individuals, to trans business owners to be able to go to school and have support to open a business in more dense areas, like Seattle and Spokane, Bellingham, Marysville, Everett, because right now there's a lot of people waiting for those services. Coming back on changes, we talked about the need for a therapist letter in order to complete your transition-related care with surgeries. The Healthcare Authority has created what's called an EPA, which is an expedited prior authorization code. And for a few procedures that already have an EPA assigned to it, I don't know how they made the decision to do it this way. It would be great if they just did it for every procedure, like everything just got an expedited prior authorization. Like, yeah, you think you need this? Yeah, I guess we'll cover it. But right now, breast augmentation has an expedited prior authorization code, chest reconstruction, and genital electrolysis. Also, a hair removal for donor tissue sites, not necessarily for the face. So just feeling that a therapist letter is still needed for other procedures, all facial surgeries, hysterectomy, metoidioplasty, which is the severing of the ligament to create a micropenis and a clitoral lengthening, orchiectomy, which is the removal of the testicles, phalloplasty, which is creation of a neopenis, and speech therapy, vaginoplasty, and vocal cord surgery still require a therapist letter. And for phalloplasty and for vaginoplasty, HCA requires 2 therapist letters. We're really lucky at Carolyn Downs Country Doctor Clinic because we have behavioral health staff in-house. So it's really seamless if a community member decides with their primary care practitioner that they're pursuing a particular procedure, they can work, in about an hour with one of our behavioral health staff, usually by telehealth, generate a letter, and then we can submit that as we try to get authorization per procedure. I want to learn more because traditionally hair removal has required a consult with a dermatologist, which can be a barrier for folks. So I maybe haven't caught up on where things are at right now. So I'm really curious about that and want to come back to it. Yeah, I'll stop talking. Thank you.
No, thank you. Thank you for sharing that wonderful information. Something that really struck for me was when it comes to a therapist letter, are there a certain amount of letters that you need for somebody that's going for any type of top procedures or bottom procedures, or is it just one letter for any area?
That's a good question. What I hear from the Healthcare Authority is they would prefer just one letter for any procedure. Traditionally, I've still been trying to tie those letters to each procedure, but I'm just noticing in myself like a hesitancy to step back and be less explicit, and that's a place where I kind of need to be a little bit braver and unfollow that. And I see in the chat there's a question about fillers and Botox. I haven't had it covered yet, especially because offices that offer Botox are not always able to accept insurance payment. They're often cash systems. So they'll say, yeah, we'll take care of that, and then you can submit a receipt to your insurance company. So that is more paperwork. But if you're the kind of person that can do that, then you should give it a try. Yeah, I don't have an answer about fillers. I need to educate myself about that. Why are 2 letters needed from several mental health practitioners? That is in the case of vaginoplasty and phalloplasty, and I think that there's sort of like a traditional fear that if your fertility is impacted, that somebody's going to get sued somewhere, and haven't been able to get around that. So yeah, right now for phalloplasty and vaginoplasty, 2 letters are requested. For other procedures, 1 therapist letter is requested. And Catherine's saying it's only 1 letter for top surgery. I'm also kind of questioning that, because if there's an expedited prior authorization code, then maybe no letters are needed. I'm not 100%. So still learning about that. Is hairline restoration also included as a treatment? It's not a listed treatment, but I think that as Maddie Mooney, who is a real genius about healthcare access, but not joining us today on this call, has pointed out that you could make an argument that it should be covered because it is gender affirming care, and it also provides safety and access to housing, jobs, etc. So I think you could easily make a single case agreement and make an argument, and I'd love to work with someone on that.
Thank you, Helen. Our comments are very impatient for the end of their shooting questions. And thank you for taking them on. So we're going to go into a short 5-minute break. I know that was a lot of information. Please sit down, simmer, absorb, take as much as you can. And if you have any more questions, shoot it at the end of our panel section. And right into our comment section there, everybody. So I'm going to roll it over to our back scene to roll out some very important information with our upcoming luau.
Ladies and gentlemen, boys and girls of all ages, JJ Productions proudly brings to you Jam More Jam Show. Sometimes I think about where I was from. The palm trees, seashells, hot summer suns, Pacific colors wherever they may be. Tahiti, Tokelau, Samoa, Fiji, sing to their glory. I've atoned for you.
Wow, Kimmy, was that you that was in that dance performance for Maori?
Absolutely. You can never go wrong with a girl that knows her culture.
And what island will you be hitting this year?
Cook Island, Tahiti, and Rapa Nui, as well as Maori.
Can you show us like a sample, like a tiny sample?
That's why we have the ticket purchase. If you want to see me on the stage. Yes, welcome back, folks. Hopefully that break was giving you more time to go and grab your pen and paper to write in all these resources that our lovely panels are putting out for community. So we're just gonna dive straight to our next question. The next question is, what questions or concerns are you hearing from community about these changes? And I will direct this to Dusty. So some confusions and barriers that community faces uh, when they going through the gender affirming care.
Yeah. I mean, I think we've talked about a lot of the number one is what is covered, right? I think that has been the most confusing barrier is what can I get covered, or can I get the thing that I want covered, and how do I do that? And then, some things that Helen brought up about combining care, how you're planning your procedures, timelines, whether revisions have been allowed under the law, which they are, or they're supposed to be allowed under the law. So there's, and that they're supposed to also, multiple procedures at once, if that is better for you versus not. So there's a lot of what I would call process confusion. And that's a lot of what that resource that I shared is trying to deal with, is just those sort of all the puzzle piece Q&As of, what about this and what about that? And then it really is like the most confusing barrier laden things are around access, like Helen was talking about, right? That, there's just a limited amount of providers for certain things, and where you are and who you are can often impact the access you have to those things, right? Even with these kind of equitable laws. And then just, it can be so burdensome navigating any of these processes. It's great that it's covered, it's a really positive step forward in many ways. And it's still really going to be a bureaucratic, burdensome process for most of this. And will take many, many months, including my friends that have been navigating it just since the law changed. And as well as my own personal experience with insurance coverage previously with trans stuff. And it just, every insurer is different. Every process is different. And the main thing is to have somebody like Helen in your life who can help you navigate, knows everything, and try to get, and honestly, so I have a friend who's working with Dr. Stiller right now. And when we're talking about surgery, most of the surgeons do have those navigators. They have the insurance navigators who are the pros, who are going to help you get everything together. Most of the bigger insurance companies in Washington now have a trans team that is supposed to be giving you information about this stuff and helping you navigate. So I think those process barriers are just built into the process. Starbucks, Amazon. I'm missing. Wait, Helen, what are Starbucks and Amazon in the chat about? Oh. I was like, hang on, I missed something here. But yeah, so those are some of the big things. Oh, there we go. Yeah, so choosing where you work around what access you have, choosing which insurance you buy around the coverage and access involved, or the providers. I mean, I know I had a problem changing to an HMO because they tried to make me change my trans doctor that I've been seeing for 10 years, and I was like, no. I'm not going to do that. I'm not going to go to some brand new trans clinic, as good as it is. I've been trans longer than this clinic's been around, And so and they didn't have a procedure for old trans people like me. They only had all these procedures for people who were just starting to transition. And I'm like, what about people like me who are just like, I just want to keep going to my same doctor to get the care I've been getting for 20 years, but under a different plan. So a lot of times that sort of knowing where you're insured, knowing all the details, it can be really confusing. It can be hard to navigate this stuff. I get really defensive as a trans person dealing with insurance, and so it's just that kind of stuff. Just the ins and outs of dealing with the bureaucracy of insurance can be really tough. And I think we all as a community have this imposter syndrome reality of we haven't been allowed access to these things as just a right for so long that we keep after telling ourselves like, no, like this is our right. So if you get denied, fight it. If you think that you asked for something that should have been covered, fight it. If you think that you're asking for something that should be covered and no one else has asked for it, like the hairline restoration, which I actually think might have been the thing my friend got covered. You know, and it was a single piece agreement, and she did have to go out of state, right? And there wasn't anyone here to provide it, but she did get her uniform regents plan, I think, to cover it in our state. But, you know, push for those, right? Like push those barriers so that we can all move forward with you if that is something you want for yourself. Because I do think there are going to be certain procedures where it is going to be really about pushing the barrier forward and just saying like exactly what Helen said about Maddie Mooney. And that, you know, that's kind of my legal brain on it too, is the insurance commissioner says other gender related facial procedures, right? So that should be hairline restoration. It should be nose jobs. It should be, you know, ideally maybe Botox and filler eventually, if we can work around getting those things embedded in places that aren't just cash only, stuff like that. I mean, we can get Botox for migraines covered, right? You know, things like that. So, you know, trying to find those creative insurance arguments where you find equitable coverage elsewhere could be another, you know, another way forward. One of the really, I'm going to share my screen again really quick because we have been hearing from the community about all the different questions they have, and we've been trying to put them into the resources. But one of the ways we're still trying to get more information from the community, Catherine and others worked really hard in this survey that's about specifically Medicaid recipients. And if you're dealing with, what is your process for what you're going through? And Catherine, please clarify any of this or add to it. But how has your treatment with Medicaid been for your gender affirming care, specifically if you've gotten denials, or what have you been going through with denials? And there, you know, I'm going to share the survey on screen really quick, but sorry, I forgot to hit the share screen. Thanks for the reminder. I started talking without sharing. So there'll be a bit of a delay for a minute, and then you all should be able to see in just a second. Okay, I see it showed up. So you should have gotten a link that when you click on it, it's a bit.ly link. It's a really short one. And when you click on it, it'll take you to survey. And it's pretty short. You might have seen a longer version of this previously, but earlier this month, Catherine worked on a slash job on it to change it up and make it a little bit friendlier for those of the community that are going to be taking it. But I just kind of want to show you what's involved so you can see the important information we're trying to find out more about from community, to see what your experiences are and how we can plug in to help with those. But it's just going to ask you some basic stuff about your gender identity, what treatments were going on, did you get denied, and then a lot of questions about the denial, right? How did it impact you? What was it like? Did you make a complaint to the insurance commissioner? Did you talk to the healthcare authority? And particularly to Utopia, you know, for members of your community, if any of you are Kofa Islander community members, we asked to track that information. I'm assuming, and Catherine, correct me, because there are particular, sometimes extra medical protections or benefits or programs for Kofa Islanders that you may be able to be accessing. And I'm assuming that's why we're asking that. And then some general demographic stuff, right? So it's pretty basic, but the information for us is super helpful. So if you get a chance, and even if you know, just get a chance to go through this, let us know. And then Catherine, do you want folks to be sharing this even if they didn't get denials, but are wanting to share like this part that was just like, tell us about your gender affirming treatment in general? Are you interested in hearing about that as well for folks who didn't get denials? Oh, you're on mute, Catherine.
Oh, sorry.
There we go. Sorry, you were still backstage.
In that information, and partly because, you know, we know these are new rules, and we want to make sure people know about the new rules and are applying, but we are also hearing success stories, like people getting facial surgeries covered for the first time, which is great. But we also, you know, we hear little snippets of problems people are having. And I want to let folks know that there's one person at the healthcare authority that is available to answer questions and help people navigate this system. I mean, one of the things that Dusty, you know, named was just how difficult all of this is, how inhumane all of this is. And we recognize that and honor that truth, but also want to let people know that there is someone at the healthcare authority tasked with assisting community members with navigating this system. And she is telling me that she's not hearing from anyone about any barriers. We know that's not true. So one of the ways I'm in touch with her, one of the ways is to get information through this survey so that I can, if there's patterns, I can share those with her. And then the other thing is just for community members to know that they can reach out directly to that person. There's both an email address and a telephone number for that person. It's included in that survey at the end to say, have you made a complaint both with the healthcare authority? And then as Dusty mentioned, there were two sort of separate good changes that happened. One that we've mostly been talking about are the Medicaid rules, which have changed last year. And so reporting that to the healthcare authority if you're having problems. And then also there was the state legislature. Many community members worked to pass a new protections so that insurance companies could not deny gender affirming healthcare as cosmetic. So there's now these two layers of protection, and the Office of Insurance Commissioner is the one to monitor compliance with that new law excluding cosmetic exceptions. So there's new places to go to get help and to make reports. And that's important because one, we want to make sure community are getting the care that they need. And two, if there are issues, then that helps us go to those agencies to try and work out those barriers. So thank you for introducing the survey, Dusty. I appreciate you.
Absolutely. Thanks for building it and all the work you've done on it.
Yeah, that was pretty, amazing on being able to gather stories on community to help benefit policy. I think that's very important because we're also including community in a part of that work and hearing from them to help move this work further and also making things better, so we don't have to face the same barriers over and over and over again.
And Adriana, can I just name that Utopia was key in helping pass that state legislation? So many folks from Utopia came forward and shared their stories and helped move that legislation forward. And so just so much love to Utopia for all of the work and heart that they put into that.
Thank you, Catherine. I think it was very important on being able to amplify the voices of our community, of our trans community in those spaces. Not everyone is meant to be an organizer. Not everybody has that courage to speak and tell their stories. But we are very happy to be that conduit that helps pool their information out, pool their stories out there, letting folks know that there is a cry for change. And we're also Utopia, alongside other friends, partners, and allies, are happy to be a part of that. There was a question that came up in mind. I'm sorry. So I know we talked about Medicaid, and I know we talked about insurance. Does the policies that are with Medicaid around gender affirming care also seen with private insurance? For folks that are like getting insurance through workplaces that are not going through Washington Apple Health Plan Finder. Are the same policies and laws applied to those insurance companies as well?
That's a really good question. And so there are a few different ways that folks can get insurance. But the short answer is no. Most of this pertains to insurance through Medicaid. But if you receive, if you get an ERISA plan, and that's a plan that's independently purchased by your employer, which I think covers like 50% of workers, most workers in this country. They are not regulated by state laws like Gender Affirming Treatment Act. So in order to figure out your benefits through that, it's recommended that you go through your own like insurance, and there should be a number on the back of your insurance card that'll provide you with, who there is your contact.
Yeah, and one of the things just to add on to what Gabriel shared about those ERISA federal plans that are not governed by state law. Those tend to be big employers in the state, like Boeing and Google, and so what that means is that employer self-funds its own healthcare, and so it creates its own plan for its workers, which means that the workers have much more say as to how coverage is determined. So in other words, if folks are working, we'll say Starbucks. If folks are working at Starbucks and they don't have a very good gender affirming healthcare plan, those workers can come together and make a demand of Starbucks to change the coverage. So it's different than like when, we went to the healthcare authority or we went to the state legislature to demand changes. This is much smaller, where the workers actually have, I think, pretty good ability to demand changes. But it's true that, these Medicaid protections and the state law do not cover those self-funded employee plans.
I know Medicaid is kind of like a state program. Similar question, but does this also apply to Medicare?
So Medicare is a federal program, so no. So there's not, these protections that we've discussed are different. And for folks, I see in the chat, for folks who have both Medicaid, which is through the state, and Medicare, Medicaid is going to be the payer of last resort. So that means if you've got Medicaid and Medicare, in some ways, it's more complicated to get things covered because it has to go through Medicare first and get a coverage determination and then go over to Medicaid. So even though you've got, two insurance plans, you should have better coverage. It tends to be that basically nobody wants to pay, and so it can be more difficult for people, and that's just an unfortunate reality of that dual eligibility process.
Thank you, Catherine. Thank you.
I also want to talk about the IRSA private insurance question. When you call that number on the back of your insurance card, I try to encourage folks to say that they need to talk to a nurse care manager and ask to get a call back from a nurse care manager, because the frontline staff answering the phone at those big insurance companies may not be completely informed or up to date. And so I try to tell people to leave a couple of messages and, leave a good time for a callback, and then start with their conversation once they get to talk to a nurse care manager. That person is either usually a social worker or an RN. So they have a level of expertise. And then the way that I would coach someone to start that conversation is to say, I need to talk about a surgery that's been prescribed by my primary care practitioner, and kind of start the conversation that way, but not necessarily give a lot of information to that frontline staff that answers the phone and takes your message, because if they're misinformed, then they will just kind of try to shut you down.
Thank you so much, Helen. And that moves us to the last question, which pertains to what you were explaining to folks on how to go about navigating the system, especially calling to get information on gender affirming care. So what resources are there for people who need more information and support around navigating the new changes? What resources can you point to in community or in your own respective organization to support those impacted by the new changes? Legal resources, one-on-one conversations, case management, organizational resources. And I will throw that to Gabriel.
This is a really great question. I am not at all an exhaustive list, but this is what I can contribute. So there are a lot of awesome legal resources. We're really fortunate to be in a state that has so many good community-centered organizations and folks. Q-Law Foundation offers a free TransHealth clinic. I believe it's the last Tuesday of every month, where folks can go and speak with an attorney for 30 minutes about any sort of legal issue. So that'll be a really good way to get kind of, if you have a legal question, or if you would like that type of support, Q-Law Foundation is a really good source for that. There are also neighborhood legal clinics as well, depending on where you live, staffed by local volunteers, like volunteer staff attorneys as well. But that, those are awesome folks, but they're not necessarily LGBTQ or trans exclusive or literate, but still a resource. There's also really awesome organizational resources. I know that Ingersoll does a lot of help with folks who, but there's a lot of other organizations that I'm sure folks can, my fellow colleagues can help elaborate on. But in addition to that, so I've been working with Q-Law Foundation on another guide. So I helped with a guide that's, it kind of goes into how folks can get access to their healthcare. And it talks specifically about how to talk to your insurance. I really like that Helen kind of provided that tidbit of ask to speak with a nurse manager, because oftentimes you can call insurance and you don't know how to have that conversation. You don't know how to broach that, right? Or you don't know, if you're speaking to a mental health professional, you don't know how to, what questions to ask to make sure that they're the right person for you, things like that. And so this guide that we wrote with Q-Law Foundation kind of helps to highlight some things that you might want to ask if you're kind of trying to vet, a potential healthcare, like a therapist for you, if you're trying to navigate with insurance and you don't know kind of what specific questions to ask, or if you just want to make sure your doctor is competent in kind of the things you need. So that kind of provides some of those soft resources. And, I think that honestly, community is the best resource for each other, right? I think that we can, I think that everyone has skills that we can provide each other. I know that the community has done a lot of really good support in post-operative care for each other, helping people as they go through post-op care, or with transit, by donating supplies or providing housing or whatever. What's awesome about this new bill, actually, is that transportation to surgery, if you have to go to have surgery, in the other part of the state, that has to be paid for you. So whereas before, a lot of folks didn't know where they were going to stay for post-op care. A lot of surgeons require you to have a place to stay for a couple of days. For example, that poses an issue for some folks. But now Medicaid is actually supposed to cover your hotel costs and your transportation. So that is really awesome. And so just letting people know about these types of things and spreading word of mouth, and also being able to provide it for folks if they need it as well, I think is, we're all we've got, right? We're all community. But yeah, so Dusty's guide, my guide will be linked, and Dusty's guide as well for the future. And I'll open it up to if y'all have any additional resources to list.
Yeah, I just wanted to encourage folks again to access the Office of the Insurance Commissioner's complaints page or phone number if you need to make complaints, because we are talking about two different laws and different kinds of applications and different rules for different plans, and it can be really confusing. But I did want to clarify that the Gender Affirming Treatment Act removed those blanket exclusions and cosmetic exclusions from all generally all insurance carriers in Washington should be providing equitable gender affirming treatment according to the language from the insurance commissioner's webpage right now. So my view of that as a lawyer is, if you've got one of those private plans, I know Kimmy, you all were asking a minute ago about what if I'm on a private plan, not Apple Health, and it does get super confusing with private plans and which ones, are affected by the laws and which ones aren't, and then all the different coverage stuff. But I encourage folks that regardless of what your plan tells you or how you think the law applies to it, if you've got private insurance in Washington or Medicaid or Medicare, any insurance in Washington, and you believe you're unfairly denied gender affirming treatment, make a complaint to the insurance commissioner's office. They don't say that those complaints are just for Apple Health or just for certain types of private insurance or just for everybody on the Regents plan or just state employees. It says generally all insurance carriers in Washington have to provide equitable gender treatment, and that here's how to complain if they don't. That's tagged in my resource that I made that I shared with you all from Washington Law Help. And in general, if you just, go to Washington Office of Insurance Commissioner and you put in gender affirming, in the search or search for it on Google. There's not a bit.ly for a good question, Helen. I don't have a bit.ly for the website, but I can put it in really quick in the chat. And then that way you all see exactly what I'm looking at, and it has the link on there too. And you can click to it right from the PDF of the resource that I shared as well. But even though that's outside of our community, like it's a big state office, we don't think of it as like a part of our community resource. But I really think that, like Catherine was saying, how the HCA says they don't get any complaints right now, that kind of stuff. Like, we need to keep being the squeaky wheel. Like we have to, like, we're not, we have to keep moving forward by being the squeaky wheel. So, and I do think that there's going to be probably some misapplication of these laws and a lot of problems and a lot of things not getting covered like they're supposed to, and a lot of people that aren't informed making decisions they shouldn't be making. And so I just want to encourage everyone to challenge your denials and make complaints, because the OIC is saying they're committed to really actively investigating those.
Yeah, and I just really want to share that the Office of Insurance Commissioner was tremendously supportive when we were moving the legislation, the Gender Affirming Treatment Act, through the legislature. They were partners with us on that. And one of the things, they wanted to know right off was how many complaints have we received? And the truth was that there weren't very many complaints that the Office of Insurance Commissioner had received about gender affirming healthcare. And I confess that as a lawyer, I tended to tell people, like, you can make a complaint there, but it's not going to change your individual situation. It might help people in the future. And people who are dealing with a denial or just life, you may not feel like you have the bandwidth to do that. And I understand that. For the community effort, it can be really important to document those issues and those complaints, so that if in the future we need to go back to the legislature or we need to go back to the healthcare authority and work out some of these additional barriers, it's so helpful to know that people have been reporting the problems that they're experiencing.
And sometimes I think we're going to be identifying barriers in the process or problems that, we're learning as we go, right? We're learning as we build a ship. And so, part of that complaints process is going to help us identify as the professionals, like, whoops, we need to do this differently, or, this needs to be done this way. And it is very real. We are such a, I think our community has been so isolated from the rights that we deserve and should be afforded that it really sometimes is one single case of a person challenging a thing that leads to a windfall of the rest of us being able to have access. It's the only reason I had top surgery covered by California student state insurance like 13, 14 years ago, and was one of the first people to do that in that state, was because the law student at my law school before me, who was a trans woman, sued the crap out of the school because she had such an inequitable experience, and she won. And it was her experience that led to me and every other student in California that up to this day has gotten any kind of trans surgery on that insurance, was all because of that one very angry and like understandably righteously offended trans woman, right? And so I think that those kind of things are still really real in our community, where if you have it in you to make a fight and you had a denial, make that fight. Hopefully you won't have to, but and reach out for help to get it too. Reach out to Q-Law, like Gabriel said. You're welcome to try to call Northwest Justice Project. It's just it's dependent on the field office you live near and their priorities. And if they have a public, it would be under the public benefits realm. If you qualify for income, NJP has a lot more qualification barriers and eligibility barriers than Q-Law might, and isn't specific to our community, but they're available too. And at times we have had really dedicated advocates, depending on the field office, who have made really incredible strides with different kinds of trans health, especially for minors, with our medical legal partnership program and stuff. So I don't want to discourage folks from reaching out to NJP. I just think they might not be your first point of contact necessarily. But it is available. And definitely, if you feel like I'm on Medicaid, I know I'm income qualified, and you were denied, give it a try too. We can just be hard to get a hold of because it takes a long time to get through our hotline and the phone line and everything. But that's an option as well.
Thank you, Dusty. And I think that's very true when you said that you don't have to fight alone. You have a bunch of allies and folks who are ready to help support you through that fight. And I think those are things that also needs to be made aware to a lot of community members, especially when it comes to trans health and gender affirming care. I feel like we move this work further, but other folks don't know what's going on. They don't know that these are some of the services that are being covered. This is kind of like why I wanted to go back to what Gabriel said about community is one of the best resources that you can get access to, because we all do informal care work. It's how we show up for one another. It's how we show up to support with experiences and things that we've already gone through. And being able to pass on and help support another person in our community with the same knowledge and experience is fulfilling, because that's how we keep ourselves and our community safe. So thank you for bringing that up, Gabriel.
Absolutely. I just want to add more to what Gabriel was saying about community. Like, it doesn't have to be an organization. It's your experience that you go through as a person, and those resources that you obtain from doing that as an individual, you can share those resources to other folks, to your sister, your brother, or friends that are seeking resources like that, and show them how to navigate the system in going through obtaining gender affirming care. So yeah, you is a resource there.
And I think that's also why we have to continue to be vigilant on sharing these new policies, new procedures, and things that are being covered by state. A lot of folks who are migrating here from states who are not ahead of us with a lot of the gender affirming care don't know about this, don't know that these are things that are being offered here. As organizers and as community organizers, it's always good to put out information, break boundaries, share resources that are available, mobilize community, getting feedback about what they're seeing. Sometimes we are so busy in the front that we don't see what's going on in the back. And taking a step back and just to get that feedback from the community, just to hear, because that's how we make changes. That's how we make changes to policies and things that are and to make it better for everyone. So this time, I want to join it over to our spectators this afternoon. If anybody has any questions, or if anybody has any concerns that they want to share out, please do so, and we can pass it on to our panelists.
I mean, oftentimes, especially in our trans community, some folks, when they do know how to navigate that system to get a gender affirming care, they tend to gatekeeping, right, sister? Gatekeeping. So, don't do that. Don't be that girl. Start sharing resources that help other folks. Help your sister out, your brother, friends. I mean, it's the only way for us to all come together and be, strong. So Don't be a gatekeeper.
I think some of the concerns and worries. This is just kind of like for feedback. We can go around and have a conversation about this. With Roe versus Wade being overturned, is there a foreseeable effect with some of the changes or that's already been made through Medicaid for gender affirming care?
I can start to answer on that. Yes, sadly, the Supreme Court overruled 50 years of precedent in a recent case. And so now there is no longer a federal right to a safe abortion. And that means that each individual state is going to be able to enact its own laws and policies around when and whether to offer abortion care. And we've seen many states enact or already have worked toward enacting very restrictive laws for abortion access or no abortion access. That's obviously horrifying, and that means that pregnant people are going to be put at risk and need to travel outside of those states. The closest to us will be Idaho, that will have a ban. The ban's not in effect quite yet, but it will be toward the fall. And so there's a lot of thinking and work being done about how to protect those folks that may need to come into Washington to access that care. But to your question about what does that case mean for the LGBTQ community, we don't know for sure how things are going to proceed from here, but the Supreme Court has made it clear a couple things. One is that any rights that we have secured, there's little reason to feel that those rights may remain. So in other words, the right to abortion has existed for 50 years, and they were willing to overturn that. Other rights have not been in existence for that long, like the right to marriage equality, the right to, interracial marriage, the right to contraception even. So there's a lot of concern around what cases will be going up to the Supreme Court and how they will handle it. So there's a lot of fear right now in the community, and it's understandable. However, none of those things have happened yet, and they are further down the line than what we're dealing with right now. And I think the most important thing is for our community to come together and really be strong and solid and supporting each other, because we're going to need that as these restrictive laws come into place or cases go up to the Supreme Court. We in Washington State are very well protected. We have a very supportive governor. We have a very supportive state legislature. And I can tell you that our governing bodies, county, city, state, governor, are all really scrambling to try and ensure protections for pregnant people who are coming into the state. And they realize that the assault against abortion care is so similar to the assaults that we're seeing against gender affirming healthcare. And so even though there's no, there's nothing denying gender affirming healthcare in our region, our state is already thinking about how do we protect patients and providers who need and offer gender affirming healthcare. So we're really being very proactive and very forward thinking about how to protect people. But I acknowledge that we are in an unprecedented time, and it's very scary. So being connected to Utopia, getting connected to your community organizations and individuals is really, really important right now to stay safe, to get information, and to show up when you have capacity to protest, to get involved in standing against these, the way the conservatives in this country are trying to move us.
Yeah,
Thank you, Catherine.
I just like to remind everybody a lot of what Catherine said just kept it make me just the thing I've been saying to a lot of people lately when they're coming to me being like, what's going on, what's going to happen, is just, we've entered a marathon not knowing where we're going. And so we're running an endurance marathon with no idea where we're heading. And if you think about it that way for your self-care and your capacity, right, we don't, what Catherine said about showing up when you can and have the capacity, the other side of that is letting yourself have the space not to when you don't, because this is a very long marathon we have entered. The course correction for this is not fast. It's not certain by any means that it's not fast at all. Like, legal change does not happen quickly. And so just reminding everybody that we have to learn to live with uncertainty, and we have to learn to live with these changes for a while, and to do what you need to do for your bodies and spirit in the sense of endurance. And thinking about this in a longer, I think as trans people, as a trans person, I'm used to it in the sense of watching how varied my rights have been in the last 25 years, depending on where I lived and who I am and who's politically in power and what's going on. But Roe is so substantially foundational in so many ways that I think it does kind of pull that sort of pull the floor out from under us in a lot of ways. So whatever you can do for thinking about being in endurance, thinking about this as a long-term process we're going to all be in now together, and not feeling like you have to respond with immediate urgency if you don't have the capacity to, because there's going to be lots of opportunity to do things moving forward. And I saw Catherine pipe in the chat about there was a question about how would trans people in the prison system have access to this gender affirming care, and I want to let Catherine address that.
Sure, yeah, and please join in. So the question around access to gender affirming healthcare, actually, I'll even expand the question out to jail and prison. It is a different system in some ways. So I'll focus on prison first, people who are incarcerated in prisons. They do have access to gender affirming healthcare in theory. In practice, it is a much longer process. It is a delayed process. It is not a humane process. However, cases have been brought forward to ensure that trans people, gender diverse people who are in prison do have access to gender affirming healthcare. We supported a trans woman in Washington State who was seeking care, and it was very delayed, and she experienced, real significant psychological harm as a result of that. She brought a case against the prison and the prison system and the Department of Corrections, and it really felt like she deserved to be compensated for the significant delay that she'd experienced. And the court said no, that it was okay for the prison to have this very long process in order for her to get access to the surgical care that she needed. So it is moving very slowly in a better direction, but it's not great. And that is for prison. In jails, there was a community coalition that came together, particularly around the King County Jail, for housing, healthcare, and treatment of trans and non-binary people who came into custody. And the jail has come along and made some good, significant changes around appropriate care, humane care for people. There are still problems with that system, let alone that no one should be put in a cage in the first place. And in the jail, you do access care through MedicAID. So the same rules that we talked about apply in the jail. it's just that because you don't have access to a phone, you don't have support from organizations, it's just more difficult to access the care, although there are community members working to try and make that a more humane, more responsive process. And that is actually moving along fairly well so far.
Yeah, I would just encourage anyone to get in touch with Danny from Trans in Prison. So Disability Rights Washington has a project called Trans in Prison in Washington, so for folks in prisons. And Danny Waxwing has been an attorney dedicated to that project for a few years now. And I think especially around medical access stuff. Thank you. Great. Yeah, and it's actually, so it's not an equal justice, it used to be Equal Justice Works, but now it's just a program of DRW finally. I think it's just fully funded, a regular old program. So this will probably reference to the old information, but it's still active as like a fully funded and growing program. And I know that Danny is really resourced at getting into each individual prison and connecting with folks. And that's the other thing I would say is that if you're on the outside supporting people on the inside who are trying to get access to care, it is so institution specific, and which prison you're at can determine so much about what your access looks like. And so just connecting with Danny could be so helpful for anyone in that process, because you will be able to connect to the pro, and he has a really great intern working with him right now too, who I think is trying to make a compiled resource of these things to be a little bit easier to navigate, at least around name and gender change for that. But Danny specifically deals with medical access. So Danny is really about, helping trans people in prison navigate medical access around these kind of things and other medical issues. Thank you, Helen. Great. Yeah, the DRW link is in the chat now.
Yeah, sorry, I had the wrong information. Thanks for Dusty for correcting that, and thank you, Catherine, for addressing that issue so beautifully with so much understanding. Yeah, just really grateful for the work that you've been doing over the years to make it possible for us to offer better care, and just feeling conscious of the ways that the marathon can impact me also, just in terms of like what I think it's possible to fight for, and staying in connection with all you beautiful, creative, organized people at Utopia is really helpful. So thank you.
Thank you. Thank you guys for being able to share those wonderful words and resources with us, and especially with our folks that are tuning in. I think that wraps up our question section. If you have any more questions, well, if you're watching this later on tonight at midnight and just laying in bed wondering, oh my word, I have a question, you can shoot that question over to support@utopiawa.org, and we will pass it on to our panelists tonight and respond to you in a couple of days with your answer. So don't worry, I'm pretty sure you're going to watch this tonight or tomorrow morning. So if you are and something pops up in your head, shoot it our way. We'll be happy to answer it for you. Thank you guys. I'm expressing a lot of gratitude for you guys on joining us tonight, not only being able to share your wonderful knowledge and experiences, but also being able to share these resources with community. Hopefully we get to have more of these conversations in the future, so that way we can keep our community informed about changes to current systems that are being currently right now. So thank you. I'm going to roll us into our closing announcement. Thank you, everybody.
Thank you so much. Such a pleasure.
Thank you.
Grateful to be here.
Okay, everybody. So that was it. Hopefully you guys were able to pick up on some very important information, some very important things to learn about our Talanoa this afternoon. But before we close off this evening, we have some announcements. So don't forget to save that date on August 6th. It's our signature luau. It's our fundraising event that's held every year. This year, it's called Lenofo. the rise to the throne. Dum, dum, dum. I think there is supposed to be some musical instrument to go with this. Berta, Kimmy, I expect you to do this next time when we go into this. Doors will open at 3 p.m. and our program starts at 5 p.m. Don't miss out. The tickets are 70% sold, so there's only like 30% left. So you don't want to miss another exciting year of our annual luau. You can purchase tickets, table, or become a sponsor, or even donate directly to us by visiting our www.utopiawad.org/luau. This link can also be found in the comment section. If you are not able to attend, you can continue to support us by purchasing a raffle ticket to win a pair of tickets to go anywhere that Alaskan Airlines flies. For more information, please click on the link below that can be found in our comment section. Berta, Kimmy, if you were to win the raffle tickets with Alaskan Airlines, where would you go and who would you take?
Ooh, that's a tough question. I would fly to, where else? Hawaii. I would love to be on a beach, enjoy my time with a Mai Tai.
As somebody who grew up in the islands, don't you want to go somewhere like a city?
And the food.
And I can't argue with you on the food.
Of course you can.
We are also having our peer support group every third Tuesday of the month. Please visit the link below in our comment section if you are looking for a peer support group. We also have our registry that helps support a lot of our community members who are within the sex worker industry. You can donate to our support a sex worker registry. Link can be also found below. I know throughout the Talanoa, we've talked about a survey that if you were to be denied care through Medicaid, please be sure to fill out this survey. The important part about filling out this survey is this is how we move the work further. So if you've gotten declined and you are going through the hassle of pushing back, telling them, no, I shouldn't be declined, please also reach out to us for support and also fill out the survey so we can have this, so we can better this policy making. And last but not least, if you are interested in volunteering for any of our events, you can do so at www.utopiawad.org/volunteer. That pretty much wraps up any of our announcements. Kimmy, you got anything to wrap up?
You pretty much said everything. So I just want to let folks know, this Talanoa is very meaningful. A lot of resources that you can obtain, how to go about on gender affirming care. So please, if you want to, you can rewatch it again on our social media via Facebook. And you can get some of the information that was missed that you might have been missed during the whole Talanoa. So yeah, thank you so much for joining us tonight at our Talanoa.
From all of us here at Utopia, Tofa
Soifua.